Define anaphylaxis describe the autopsy appearance of a case of death due to anaphylactic shock. Anaphylactic shock is defined as a fatal condition occurring rapidly after exposure to an antigen and producing clinical features of profound generalized shock, acute respiratory distress, asphyxia, severe hypotension, and death. While occurring most frequently with intravenous or intramuscular administration of highly sensitive person, it can also occur after ingestion or inhalation of antigenic substance. The common offending agents are bee or wasp sting, serum or drug therapy in previously sensitized person, injection of penicillin or local anesthetic or desensitization injection with a colon extract. If death is suspected to be due to anaphylactic shock, a detailed history should be obtained as regards the possible cause and history of allergy to any non-pollen. Autopsy should be done as soon as possible as laryngeal edema recedes after death and may not be observed otherwise. Many of these following features will be seen. This may be grouped under general external examination, internal examination, microscopic finding. External examination, the site of injection or sting must be sought, photographed, and excised with a 5 cm margin of skin and underlying tissue for laboratory examination of antigen. There is usually local swelling of the involved tissue. There may be edema of face, eyelid, conjunctiva, or lips. Asphyxial changes include subconjunctival hemorrhages and froth in mouth and nostrils. Generalized petechial hemorrhages in the skin are usually due to vasodilatory and increased permeable effect of histamine and other vasoactive amines. Internal examination, there may be edema of glottis and epiglottis spread to the vocal cord and causing laryngeal obstruction. This edema recedes soon after death. The remark glottis together with epiglottis should be photographed from above for a permanent record. Tracheobronchial secretion contains frothy fluid and mucus. The lungs are heavier than usual, greatly distended and show alternating area of pink emphysema and plum-colored collapse. The visceral pleura often shows a scattered petechial hemorrhage. On cut section, the lung exudes copious frothy hemorrhagic fluid. Features of bronchospasm are often found. The bronchi may appear constricted, the lumen narrow and filled with frothy blood-tinged fluid. Petechial hemorrhage may be found on the visceral pericardium, and the pericardial sac may contain a moderate amount of straw-colored transudate. The right heart is dilated due to acute pulmonary failure. A specimen of blood should be retained for immunological studies, antibody titer, and for drug level. There is acute congestion of abdominal viscera. Edema or hemorrhage is sometimes found around one or both renal pelvis. Lymph node at the porta hepatis and mesentery may be enlarged and hyperemic. The brain shows diffuse congestion, often with petechial hemorrhages in the white matter. Dr. Rita Vijay, 27 years of age, was working as a gynecologist at JJ Hospital, Bombay. She died of anaphylactic shock in about 5 minutes after a long-acting penicillin injection was given intramuscularly. She had been suffering from rheumatic heart disease and has undergone surgery to replace her mitral valve in July 1988. Since then, she was being treated regularly with injection of long-acting intramuscularly. When this injection was given, 10th December 1988, at the OPD, she started to gasp for breath, bronchial constriction, histamine effect, and began sweating profusely. She could not be saved despite resuscitative measures which include mouth-to-mouth respiration, oxygen, cardiac massage, adrenaline, and steroid injection. At postmortem, submucous hemorrhage in the respiratory tract, distended heavy lungs, and petechial hemorrhages in the pericardium and white matter of the brain were found. Microscopic finding. When autopsy is not carried out quickly, laryngeal edema resides. However, submucosal laryngeal edema and eosinophilic infiltration will be seen on microscopic examination. Histology of lung confirms a diffuse or focal pulmonary distension, acute emphysema alternating with a collapse and bronchiolar constriction. Histamine affect pulmonary arteries, arterioles and capillaries shows marked dilatation. Hyperemia and occasional hemorrhage may be seen in the Peyer's patches of the small intestine, lymph node of the porta hepatis and lymph node of the mesentery. The spleen shows a eosinophilic leukocyte in a red pulp. Thank you.